self-monitoring of blood glucose. We call it SMBG also, and it is the cornerstone of diabetes management. It is an empowering tool that allows you to be an active partner in treatment and eventually in prevention of future diabetes-related complications. It also helps you in modifying lifestyle habits, coping in time of illness or stress, and aiding you to make necessary changes in the dose of insulin or other medications. But first, let's understand who needs to self-monitor blood glucose. Patients with any type of diabetes, including pre-diabetes, and especially those who are trying to keep glucose levels in near normal range for prevention of complications. Secondly, individuals with a tendency to develop severe ketosis. The third ones are the people who have hypoglycemia unawareness. The fourth one are the individuals who are on intensive treatment, which include insulin pumps or taking multiple insulin injections throughout the day. Let's talk about the benefits of self-monitoring of blood glucose levels. Firstly, it provides an objective feedback on blood glucose values, which is used to make adjustments in your food intake, activity patterns, and medication dosage. Secondly, it supports and enhances a diabetes care program that can educate you about the condition. It also produces accurate records of daily glucose fluctuations and trends, as well as alerting you to acute episodes of hyperglycemia as well as hypoglycemia. It provides you with a tool for achieving and maintaining specific glycemic goals. Now let's talk about how frequently you should check your blood glucose. To be honest, it depends on certain factors. For example, the level of glycemic control, the type of diabetes, and the willingness to do independent glucose checks. However, there can be certain barriers to self-monitoring of blood glucose. The first one can be that the monitoring method should actually match your level of skill and aptitude. Other factors that affect SMBG performance include visual acuity, fine motor coordination, cognitive ability, and comfort with technology. And of course, the willingness and cost is another factor. The third one can be psychological issues such as fear of increased values and increased guilt, which can impede blood sugar monitoring. Just remember that self-monitoring of blood glucose is extremely helpful in providing information on your dynamic blood glucose profile. This information is very vital and helps with appropriate scheduling of food, determine which foods or diet are best for one's control, activity, and how well the medication is working. It is also beneficial to understand the timing of blood glucose variations, reduce anxiety, and increase your understanding of hypoglycemia.